All right, good morning, everybody.
Good morning.
I want to thank you for joining us as we recognize Mental Health Awareness Month. I'd like to highlight the great work being done by Cook County Health and our partners to help communities in the areas of mental health, behavioral health, and substance abuse disorders. Let me recognize some of the folks who are with us. Chairman of the board, Cook County Board of Commissioners, Chairman Daley. David Evers, who's representing Commissioner Dennis Deere, who also serves as Vice Chair of Cook County Board of Health and Chair of the Cook County Health and Hospitals Committee of the board. Israel Rocha, who'll be with us shortly, who is our CEO. Dr. Lamar Hasbrouck, who's the Chief Operating Officer for Cook County Department of Public Health. We also have with us, and who will be speaking, Adrian Cardnas from Loft 8, who is a Loft 8 Corners, which is a Pillars Community Health. Ulysses Cardnas, who's a Loft 8 at 8 client. Dr. Betty Green, founder and executive director of LAMP. Damian Frazier, who's a LAMP client. Ing Svensson, who's director of behavioral health at the Center on Halstead. And Israel has joined us. Thank you, Israel. Thank you to all our community partners and grantees who've come out today to help us celebrate Mental Health Awareness Month. They represent some of the organizations which have been awarded grants to address mental health needs, including Positive Youth Development. A special recognition to Mr. Damian Frazier, a member of the LAMP Mentoring Program. Even though the COVID-19 health emergency has ended, the impact of the pandemic lingers. Anxiety, depression, and substance abuse disorders among people of all ages have increased since the start of the pandemic 3 years ago, when nearly 50% of Americans reported recent symptoms of anxiety or depression, and 10% felt their mental health needs were not being met. Considering what a considerable role mental health plays in every aspect of our lives, it's important to guard and improve psychological wellness. That was why I was so pleased to announce last February that we were granting $16 million to community organizations as part of the county's Building Healthy Communities Behavioral Health Initiative. Supported by federal funding under the American Rescue Plan Act, ARPA, the grants support positive youth development, behavioral health services, opioid overdose prevention and harm reduction programs, and food security initiatives throughout suburban Cook County. This initiative strengthens our commitment to promoting and building health equity across the county. It focuses on the significant and negative impact that inequities in youth services, mental health, substance abuse services have on the people and communities in suburban Cook County. It will also increase access to behavioral health and substance abuse services and treatment for suburban Cook County's most vulnerable communities. Thanks to our Cook County Health and our community partners for all that you do each day to make this possible. Now, I'm going to ask each person to introduce the person who comes after them. And next up is Commissioner John Daley, Chairman of the Finance Committee of the Board.
Thank you very much, President Preckwinkle, and to you and to your leadership. I want to thank you for when COVID started, you addressed this issue immediately. To Israel, to Doctor, I want to thank you. This and all the partners. In the news this morning, we heard that Rosalind Carter has dementia, and I want to remember that family, because really, as president, he truly addressed the issue of mental health. Was the first man in the presidency that addressed this issue and passed an act. To the partners behind me, I congratulate you and thank you for your strong leadership within the community. Every single one of us knows an individual, family member, neighbor, friend who has been addressed with mental health, not only mental health, behavioral health, alcohol, as well as drugs. You do an outstanding job. We look forward to our continued helping you in your respective communities, and it's my honor to introduce you an individual who has done an outstanding job. We remember Dennis Deere, a good friend. Dennis can't join us, but his aide is here, David Evers.
Thank you, Chairman, and Happy Mental Health Awareness Month. Even though it's the last day, it's good to speak on this issue. My name is David Evers, representing Cook County Commissioner Dennis Deere, Chair of the Health and Hospital Committee and Vice Chair of Cook County Health Board. I'm glad to see a lot of the organizations here today that are recipients of this grant. Very happy to see my good friend, Dr. Betty Ellen Green of LAMP. North Lawndale is a special community that's near and dear, not just to my heart, but Commissioner Deere's heart. He was born and raised there, as well as he raises his family. And I'll leave with this. Commissioner Deere always leaves a Deerism, if you will. And he says if you want to get something you never had, you got to do something you never done. And we're doing that today with these grants. Not only we're trying to end the stigma around mental health, but we're trying to provide the necessary resources to those in the communities that need it. So thank you, President Preckwinkle, for your leadership. Thank you, CEO Rocha, for implementing what is necessary, Dr. Hasbrouck as well, and all the organizations that's behind us for doing the great work. And I'll pass it now to our CEO of the Cook County Health System, Israel Rocha.
Good morning, everybody. Good morning. Pleasure to be with you. It's a pleasure to be here with you today as we close out Mental Health Awareness Month. I'm Israel Rocha, CEO of Cook County Health. I'd like to start by recognizing President Preckwinkle for her support of our health system and unwavering advocacy for the residents of Cook County Health, and especially for the advancement of mental health services across our system. I'd also like to thank Commissioner Daley, Commissioner Deere and his team, and the entire Cook County Board of Commissioners and our Board of Directors for their tireless support in building Cook County Health to have additional healthcare services, especially in the mental health space. I would also like to recognize our Building Healthy Communities partners, some who are with us here today: the Center in Halstead, Chicago Lawndale AMACHI Mentoring Program, or LAMP, the Pillars Community Health, the Arab American Family Services Program, the Asian Health Coalition, NAMI Metro Suburban, Shoot Your Best Shot, and the YWCA. These organizations are making significant impact on the health and well-being of the communities that they serve, and we are grateful for their dedication and expertise and partnership with our system on advancing mental health services, and most importantly, creating new points of access. I would also like to acknowledge the impressive youth who are with us here today, especially Damian Frazier and Ulysses Cardenas, who are participating in the teen development program supported by our Building Healthy Communities grant. We are here today to close out May as our Mental Health Awareness Month. Mental health awareness is an important part of everyone's well-being, and Mental Health Awareness Month is an important step because, like most conditions, knowledge is power. Understanding that we have an opportunity, understanding where access lies, and being able to be emboldened by the support and stories of others to hear others taking action to control their mental health is important. So this month helps to determine how a person is able to operate physiologically, emotionally, socially, by helping to share stories and empowering one another and lifting our community. It is a critical component of one's ability to flourish in all aspects of life. In 2021, we know that 1 in 5 adults experience some form of mental illness, and 1 in 3 teens reported poor mental health nationally. Mental health concerns impact every demographic, every age, every socioeconomic group. In many ways, you can say it's one of our greatest equalizer because we are all impacted equally. Although COVID-19's public health emergency has ended last week, we continue to see increased rates of anxiety, depression, and substance abuse, which remain. Across Cook County Health, we are also seeing alarming rates of substance abuse. We have grown our treatment services across the health system, now offering MAT care for substance use disorders at every single one of our community health centers, and through a unique walk-in rapid access bridge clinic program right here on the west side. Fentanyl is a part of our toxicology screening at Stroger Hospital, so we can put a finger quickly on individuals who are suffering from this ailment. And I would like to thank our chairman who's with us, Chairman Daley, who was able to see this in an article and said, are we doing this at our hospital? And we checked and we determined that most hospitals were not taking this step to be able to evaluate and to add fentanyl testing as part of their standard tox screening programs so that we could get care faster to patients who need it. After some research, we were able to do it at an economic cost, adding new programs and new assistance. So thank you, Commissioner Daley, for flagging that for us and for making sure that we have an increasing better standard for tox screening to be able to render assistance to patients faster. If a patient tests positive for fentanyl, it flags our recovery, it coaches assistance, and it connects the patients with substance abuse treatments before they are discharged. Care continuity and support now has new meaning in mental health services here at Cook County Health. Since the onset of the pandemic, outpatient visits to Cook County Health and our behavioral health clinics have increased from more than 34,000 in 2019 to 42,000 in 2022. Across our system, Cook County Health is working to make life a little easier for someone who says that they need help, and most importantly, our goal is to continue to build opportunities to have care in the right place, in the right time, and when they need it. In February of this year, we announced the recipients of our Building Healthy Communities grants who are doing just that. Funded through our Cook County government's ARPA funding program, thanks to President Preckwinkle and the County Board of Commissioners. Cook County Health and our Department of Public Health has provided $16 million in grant funding to support community organizations' mental health, positive youth development, and food security programs. Today, we are thrilled to share the results of our partners that they have achieved in just the first quarter of the grant. Some of the grantees here with us today will provide more details about their vital work and what it means to be able to have new mental health access across our county. In all, thanks to the grant funding, more than 43,000 people have received food security support. Nearly 1,500 people have benefited from mental health services through new points of access, and more than 1,200 children and teens have been served in positive youth development programs. That is an incredible point of access and success through this program, and we celebrate the accomplishments of all our partners here today. These are significant numbers in the first quarter of work, and most importantly, represent real people who are getting the services they need to live healthier lives, not only physically, but mentally and emotionally, and able to thrive here at Cook County Health and in Cook County. So we congratulate our partners, we congratulate the success, and are excited to bring to you what we've been able to accomplish through this program. And now I am happy to bring up a key component in helping to roll out this program, Dr. Lamar Hasbrouck, our Chief Operating Officer for the Cook County Department of Public Health. Thank you so much.
Thank you, Mr. Rocha. So good morning. I want to thank, got to be ready for that. I want to thank the President and Chair Daley, also David on behalf of Commissioner Deere, as well as Mr. Rocha. So I'm Lamar Hasbrouck. I'm the Chief Operating Officer for Cook County Department of Public Health. And what I will say is this, there's a lot of statistics that I can name. I'm not going to share any statistics today because I think the most compelling proof point is the fact, as has been mentioned, each of us has either dealt with, either directly or indirectly, with new or worsening mental illness or substance use in our families or in our circles. And so that really is, I think, the most compelling proof point to why we're here today. The vast majority of Americans in a number of national studies have said that they believe that mental health is a crisis in the U.S., and they would be right. And so today, what we know is that although the crisis is improving slightly, it's still not fully understood, and especially among communities of color and among our youth. So Cook County and all the champions behind me, with the support of the commissioners and the president and all the other champions, really understand that mental health is an integral part of overall health, overall wellness, and well-being, mind, body, and spirit. We are committed to building healthier communities with our partners, some of which are behind me, so that they can adapt, recover, and thrive during life's most challenging times. In January, the Cook County Department of Public Health, we launched a year-round campaign called Here to Hear You with NAMI. That's the National Alliance for Mental Illness in Chicago. And Here to Hear You reminds Cook County residents that they can thrive at any stage of their mental health journeys and that they are not alone in the process. In fact, someone's on the other end of that phone who is here to hear you and to refer you to the important services that you might need. In addition, as has been mentioned, to address the overwhelming need for access to mental health in terms of prevention, treatment, and support services in suburban Cook, we have awarded over $25 million over the next 4 years, funding to over 60 organizations, and 6 of those organizations are represented here today. So we want to continue to promote these resources, and I will say that these, as represented by the champions behind me, that these resources and the harnessing of the power of partnership will be leveraged to continue to promote and expand mental health services as well as substance use services. So for example, who do we have with us today? So we have the Arab American Family Services, and they're going to be using some of this funds to launch a culturally informed campaign and community education workshops that reduce stigma and myths associated with mental health. We also have the Asian Health Coalition. They're going to use some of this funding to expand programs to reduce the burden of mental illness among populations and communities of color. YWCA Metropolitan Chicago will expand crisis services for victims of sexual and community violence and provide violence education in school, violence prevention education in school. The Shoot Your Best Shot Roots program is focused on leadership development and in helping youth and young adults make better and healthier choices. And then we have NAMI Metro Suburban. And NAMI Metro Suburban will focus on mental health workforce shortages by training the next generation of peer recovery support specialists through their Certified Recovery Support Specialist Internship Hub. And last but not least, we have Pillars Community Health, who will, in partnership with NAMI Metro Suburban, has launched a teen living room. It's called The Loft at 8 Corners. The facility is the first of its kind in Illinois, and is giving teens and their families a comfortable and inviting environment in which to speak with a licensed clinician or a peer recovery support specialist. So we know the word loft means to lift up, and I have no doubt that this beautiful space, along with the services offered therein, will do just that for our youth. So to hear more about that, I want to introduce Adrian Cardenas, who is the coordinator of the Loft at 8 Corners. Adrian.
Thank you and good morning, everyone.
Good morning.
My name is Adrian Cardenas, and I am the Pillars Community Health Coordinator for the Loft at 8 Corners. So I know we didn't hear some statistics, but I'm going to go ahead and throw some in just real quick. According to the CDC in 2021, more than a third, so about 37% of our high school students reported poor mental health experiences during the COVID-19 pandemic. And around 44% reported they persistently felt sad or hopeless during the past year. Located in Brookfield at 8 Corners, the Loft at 8 Corners is a partnership with Pillars Community Health and NAMI Metro Suburban in response to the youth mental health crisis. The space is for teens who are in and entering high school to address their own mental wellness and to take ownership in accessing their own services as well. We offer an array of groups, from psychoeducational groups rooted in evidence-based practice, processing groups, creative arts, and movement. We also offer one-on-one peer support with a recovery support specialist who is a young adult living well in their own mental health recovery, and they're able to share their own story and relate a little bit more with their teens who come through the door. We also have a family support specialist who is there for our parents to provide a lot of that support and education on how they can better support their own teen in their mental health journey. We're open 365 days a year, 7 days a week from 1 to 8 p.m., and all services that we offer are free of charge. While open for 2 months, the Loft at 8 Corners currently has 50 teen participants registered to participate in our services there, with yoga being the most utilized because who doesn't love free yoga? While we are closing out Mental Health Awareness Month, we are also welcoming Pride Month June 1st, tomorrow, and introducing our new group, Q&A Queers and Allies, for our teens who identify with the LGBTQIA+ community. I would like to introduce Ulysses Cardenas II, who is not only my brother, but also a teen participant at the Loft at 8 Corners, who will briefly speak on how the Loft at 8 Corners aids him and his own mental health journey. Thank you.
Hello, everyone. I'm Ulysses Cardenas. I'm the brother of Adrian, but also a participant at the Loft at 8 Corners. I first want to talk about how the Loft at 8 Corners has helped me through my mental health journey. First, not only has my mental health been impacted through the whole COVID-19 journey, but also just growing up as a teen itself. Being a minority itself, it's been hard at times, definitely. So looking for guidance and helpness has been a key component in my life. Talking with my brother Adrian, he told me that he and some others are opening a teen mental health community center, and I really wanted to take acknowledge of that. Not only did I think that it was such a great component to have, but people that are focused on people my age and our mental health. So I thought how that was so important, and I felt important and needed and wanted, if I could say that. So benefits that I have from the Loft at Eight Corners is that I have learned new ways to cope with my mental health. I have been able to be calm in my mental health with COVID-19 happening. My mind has been wandering and racing with so many thoughts on what was this whole process going on and how can I come out of this process as a new person. So this place has really helped me just expand my, my knowledge on how to cope with my mental health growing. The Loft also has so many community activities and events, not only yoga, as Adrian said, but there are places and classes like coloring where we can just calm ourselves, calm our minds, be able to be ourselves and really reach into that point of our mental health and control how to work that. Also, the workers at the Loft at Eight Corners has really welcomed me with open arms. They have showed me how important I am, how needed I am. So I feel very welcomed by their whole society as a whole. Now the values of that is I live pretty far from Brookfield. However, knowing that it's the only place for teen mental health, I feel very important. I feel that with me being in that age range and also having age as my brother, I felt very lucky to have that place there for me. Knowing that place is guided for people my age and teens my age, I feel very wanted, and I feel very lucky, as I said previously. Also, I feel that being in classes with other people my age, like teens, older and younger, we can relate to each other on a very relatable level because we can talk about certain events that have happened in our life. So I'm very lucky for the opportunity. I want to thank the Loft at Eight Corners and Adrian for helping me through my process of mental health. So now I want to welcome Dr. Betty Green.
I believe Dr. Betty Green is next.
Good morning, everyone. Good morning. I'm the Executive Director of the Lawndale Lamachi Mentoring Program, which is called LAMP by most people. At LAMP, we feel that every youth need a positive, culturally competent adult in its life in addition to their parent. Therefore, we provide total wraparound services to the children in North Lawndale. Even though we are primarily a mentoring program, we provide to those students who have academic achievement gaps tutoring. To other students, we provide enrichment. In addition to that, we take all of our youth on field experiences monthly to expose them to activities outside of our immediate community. We provide them restorative justice peacemaking circles because some of our students lack personal peer relationships. So we provide those circles so that they can learn to get along with everybody. We feel that if students are involved in active and meaningful experiences, that will keep them, reduce the chances of them having mental health problems. However, sometimes they have traumatic experiences that causes the mental health problems. And we refer them to another agency within our community for counseling. That agency is I Am Able. Those are the activities we do during the regular school year. However, we want our children to be involved all year. So during the summer, We provide summer youth employment for the 16 through 24-year-olds. And of course, we have some 13, 14, and 15 that we seek funding from the Staines Family Foundation to involve them in some kind of counseling too. All of our students have to provide community service. We want them to give back to the community. One thing we have them do is clean up the community, because we feel that a clean community is a healthy community. Being involved with the parents is another very important area that we work with. We involve all of our parents in workshops, support groups, and fun-type activities that make the relationship between the mentors, LAMP, and the children more harmoniously. I'm proud to say that we don't see our children in the street acting up, because they spend their time when they're not in school at LAMP. Thank you.
We'd ask Damian Frazier to speak as a LAMP client.
Thank you guys for having me here today. So originally I came to LAMP through work study. So just not to overtalk. A few years ago, I was shot outside of my school. I had difficulties with getting up and going to school. I was actually considering even dropping out, but thanks to my LAMP family, they supported me as well as helped me get in contact with counseling and other mental health resources that, you know, helped me get back there. My auntie passed away as well a little bit after that. I had LAMP to support me, but because of that, I also had, I suffered from housing inadequacy, but they was also able to help me find good housing as well as through COVID. My LAMP family always supported me to make sure I get good grades in school, and I knew if I didn't, I would have to hide from Dr. Green for a little bit. Anytime I needed to vent or talk to someone, I always knew I can talk to my mentors, Ms. Robinson and Ms. Alexis. They taught me how to be a positive role model. They helped me learn self-confidence. They let me come to tune with who I needed to be as a young black male. When I was offered a job as a recovery counselor almost about a half a year ago, I wasn't going to apply for it. I really didn't even think I was qualified or like I was good at the job, if you guys know what I mean. But my LAMP family was very supportive. They pushed me into doing it. They guided me. They supported me through the application process, through the hundreds of interviews I had. It was forever. But I got the job, and I've been a recovery counselor, again, for about a half a year now. So I work with people with mental illness, physical disabilities, substance abuse. That's about it. Sorry if I'm a little nervous.
You're doing fine. Don't worry.
I would like to introduce I'm sorry, I can't.
Swenson.
Swinson, I'm so sorry.
No problem.
Thank you. Speaking of nervous, oh my goodness, about to faint right now. So we're gonna hang with me. So I'm Ing Swenson. I'm the Director of Behavioral Health over at Center on Halsted. If folks aren't familiar with that, it's the Midwest's largest LGBTQ center here in Chicago. Yay. Thank you for having a safe state and city for us, especially as our T, GNC, NB communities are under attack in other states. So it's nice to be here and represent that we're supporting our community, specifically the city of Chicago is. At Center on Halsted, we have a ton of different services, but what I'm here to represent is behavioral health. So specifically, we have individual and group counseling, we have relationship counseling, we have legal advocacy services and case management. We have letter support for those of us who need gender-affirming surgeries and such. Let's see, and mine drawing a blank. And then along with our behavioral health department, we have a ton going on at Center altogether, right? We have a gym, a theater, yoga, as someone has mentioned. We have that too over at Center. We have our senior and youth department, and I know that specifically we're talking about like youth development, and we partner very closely with them and serve those folks who are 10 and to the grave. So we hit the lifespan across, and again, I'm so glad to be here representing the community, and I think I did it. Is that it? All right.